Hey friends, welcome to Nursing Online Education. In this video, we will be discussing important question and answers of different nursing comparative examinations. Guys, let's get started. Here is our first question.
1A client with pneumonia has a temperature of 102.6 degrees Fahrenheit 39.2 degrees Celsius, is diaphoretic, and has a productive cough. The nurse should include which of the following measures in the plan of care? A. Position changes every 4 hours. B. Nasotracheal suctioning to clear secretions. C. Frequent linen changes. D. Frequent offering of a bedpan. The answer is option C, frequent linen changes. 2. The nurse reviews an arterial blood gas report for a client with chronic obstructive pulmonary disease, COPD. pH 7.35, PC 0262, PO 270, HCO 334. The nurse should A. Apply a 100% non-rebreather mask. B. Assess the vital signs. C. Reposition the client. D. Prepare for intubation. The answer is option B. Assess the vital signs. 3. If the nurse notes the following symptoms after the client begins taking sertraline, Zoloft, which one is most likely drug-related? A. Polyuria. B. Diplopia. C. Drooling. D. Insomnia. The answer is option D. Insomnia. 4. Which of the following diets would be most appropriate for a client with chronic obstructive pulmonary disease, COPD? Low-fat, low-cholesterol diet. B. Bland, soft diet. C. Low-sodium diet. D. High-calorie, high-protein diet. The answer is option D. High-calorie, high-protein diet. 5. The physician has prescribed sertraline, Zoloft, 50 mg daily for a client with depression. Which findings should be reported to the physician? A. The client takes Tagamet, cimetidine, for acid reflux. B. The client takes the medication with meals. C. The client takes the medication once a day at bedtime. D. The client takes Aleve, naproxen, for arthritis. The answer is option A. The client takes Tagamet, cimetidine, for acid reflux. 6. A patient was diagnosed with depression 6 weeks ago and was prescribed antidepressant drug. 1 week ago the patient started to complain of irritability and had difficult sleep for only 3 hours daily. Which of the following is the best nursing action? Inform the doctor to increase the dose. B. Ignore the patient complaint. C. That's a side effect of the medication. D. Give the patient hypnotics. The answer is option C. That's a side effect of the medication. 7. 6-year-old girl tried to suicide by taking a large amount of Valium, benzodiazepines. The nurse knows that the antidote for this drug is A. Flumazenol. B. Benztropine. C. Meperidine. D. Naloxone. The answer is option A. Flumazenol. 8. The nurse would expect to find which information when reviewing the history of a client diagnosed with multiple sclerosis. A. Visual problems. B. Increased sensitivity to pain. C. Ascending weakness and numbness. D. Confusion and disorientation. The answer is option A. Visual problems. 9. The antidote for morphine overdose is A. Naloxone, Narcan. B. Flumazenol, Romazicon. C. Benztropine, Cogentin. D. Meperidine, Demerol. The answer is option A. Naloxone, Narcan. 10. The nurse assesses a respiratory rate of 10 on a client with cancer who has just received a hydromorphone hydrochloride, dilaudid, injection. Which drug should the nurse be prepared to administer? A. Naloxone, Narcan. B. Flumazenol, Romazicon. C. Benztropine, Cogentin. D. Meperidine, Demerol. The answer is option A. Naloxone, Narcan. 11. Which of the following drugs is the antidote for magnesium toxicity? A. Calcium gluconate, calcinate. B. Hydralazine, aprezoline. C. Naloxone, Narcan. D. Ro. D. Immune globulin, Rogum. The answer is option A. Calcium gluconate, calcinate. 12. A client with myasthenia gravis is suspected of having cholinergic crisis. Which of the following indicate that this crisis exists? A. Ataxia. B. Mouth sores. C. Hypotension. D. Hypertension. The answer is option D. Hypertension. 13. A client with myasthenia gravis is receiving pyridostigmine, Mestinon. The nurse monitors for signs and symptoms of cholinergic crisis caused by overdose of the medication. The nurse checks the medication supply to ensure that which medication is available for administration if a cholinergic crisis occurs. Vitamin K. B. Atropine sulfate. C. Protamine sulfate. D. Acetylcysteine, Mucomyst. The answer is option B. Atropine sulfate. 14. Which of the following is the purpose of providing atropine prior to anesthesia and surgery? A. To decrease salivation, decrease secretions. B. To increase blood pressure. C. To facilitate breathing. D. To decrease muscle tone. The answer is option A. To decrease salivation, decrease secretions. 15. A client is diagnosed as having secondary Cushing's syndrome. The nurse knows that the client has most likely been taking which medication? A. Estrogen. B. Penicillin. C. Levastidine. D. Prednisone. The answer is option D. Prednisone. 16. A patient has the following preoperative medication order: morphine 10 mg with atropine 0.4 mg IM. The nurse informs the patient that this injection will decrease nausea and vomiting during and after surgery, B. Decrease oral and respiratory secretions, thereby drying the mouth. C. Decrease anxiety and produce amnesia of the preoperative period. D. Induce sleep, so the patient will not be aware during transport to the operating room. The answer is option B. Decrease oral and respiratory secretions, thereby drying the mouth. 17. A 40-year-old woman is admitted in labor with high blood pressure, edema, and proteinuria. She is started on magnesium sulfate. The nurse caring for her should be sure to keep which drug at the bedside? A. Calcium gluconate, B. Naloxone, Narcan, C. Phenytoin, Dilantin, D. Glucose. The answer is option calcium gluconate. 18. Which of the following diets would be most appropriate for a patient has Cushing's syndrome? A. High protein diet, B. High potassium diet, C. High calcium diet, D. High iron diet. The answer is option C, high calcium diet. 19. Vitamin K is prescribed for a neonate. A nurse prepares to administer the medication in which muscle site? A. Deltoid, B. Triceps, C. Vastus lateralis, D. Biceps. The answer is option C. Vastus lateralis. 20. Which of the following interventions should be taken to help an older client to prevent osteoporosis? Decrease dietary calcium intake, B. Increase sedentary lifestyles, C. Increase dietary protein intake, D. Encourage regular exercise. The answer is option D. Encourage regular exercise. 21. An adult is admitted with heart failure. The nurse notes that he has neck vein distension and slight peripheral edema. The nurse knows that these signs indicate which of the following? A. Pneumothorax, B. Right-sided heart failure, C. Cardiogenic shock, D. Left-sided heart failure. The answer is option B. Right-sided heart failure. 22. When the nurse on duty accidentally bumps the bassinet, the neonate throws out its arms, hands opened, and begins to cry. The nurse interprets this reaction as indicative of which of the following reflexes? A. Moro reflex, B. Babinski reflex, C. Grasping reflex, D. Tonic neck reflex. The answer is option A. Moro reflex. 23. A patient who has required prolonged mechanical ventilation has the following arterial blood gas results: pH 7.48, PaO 285 mm of mercury, PaCO 232 mm, Hg, and HCO 325 milliequivalent/L. The nurse interprets these results as A. Metabolic acidosis, B. Metabolic alkalosis, C. Respiratory acidosis, D. Respiratory alkalosis. The answer is option D. Respiratory alkalosis. 24. A patient has the following ABG results: pH 7.32, PaO 288 mm of mercury, PaCO 237 mm of mercury, and HCO 316 milliequivalent/L. The nurse interprets these results as A. Respiratory acidosis, B. Respiratory alkalosis, C. Metabolic acidosis, D. Metabolic alkalosis. The answer is option C. Metabolic acidosis. 25. The nurse forgot to give the patient his prescribed drug. When the head nurse asked who is responsible for this, the nurse replayed, "That was my wrong." This considered responsibility, B. Ignorance, C. Abandonment, D. Honor. The answer is option A. Responsibility. 26. When the patient vomits postoperatively, the most important nursing objective is to prevent dehydration, B. Aspiration, C. Rupture of suture line, D. Met. Alkalosis. The answer is option B. Aspiration. 27. The nurse is discussing dietary sources of iron with a client who has iron deficiency anemia. Which menu, if selected by the client, indicates the best understanding of the diet? A. Milkshake, hot dog and beets, B. Beef steak, spinach, and grape juice, C. Chicken salad, green peas, and coffee, D. Macaroni and cheese, coleslaw, and lemonade. The answer is option B. Beef steak, spinach, and grape juice. 28. A client is recovering from abdominal surgery and has a large abdominal wound. A nurse encourages the client to eat which food item that is naturally high in vitamin C to promote wound healing? A. Milk, B. Oranges, C. Bananas, D. Chickens. The answer is option B. Oranges. 29. Which of the following reflexes is considered a normal reflex of the newborn? A. Moro reflex, B. Rooting reflex, C. Plantar reflex, D. Tonic neck reflex. The answer is option B. Rooting reflex. 30. Patient with aortic aneurysm. Which of the following is the most dangerous complications? A. Embolism, B. Rupture, C. Stenosis, D. Hypotension. The answer is option B. Rupture. 31. 56-year-old patient suffers from heart failure. When the nurse examines his lungs, she noticed the presence of crackles, which means that the patient has A. Right-sided failure, B. Left-sided failure, C. Biventricular failure, D. Congestive heart failure. The answer is option B. Left-sided failure. 32. The nurse teaches a client with chronic obstructive pulmonary disease, COPD, to assess for signs and symptoms of right-sided heart failure. Which of the following signs and symptoms should be included in the teaching plan? A. Clubbing of nail beds, B. Hypertension, C. Peripheral edema, D. increased appetite. The answer is option C, peripheral edema. 33. A surgery procedure that must be done within 24 hours is called selective surgery, B. Elective surgery, C. Urgent surgery, D. Emergency surgery. The answer is option C, urgent surgery. 34. Early sign of ARDS in a patient at risk. A. Elevated CO2 level. B. Hypoxia not responsive to O2, cyanosis. C. Metabolic acidosis. D. Severe, unexplained light imbalance. The answer is option B, hypoxia not responsive to O2, cyanosis. 35. A nurse is assessing a female client with multiple trauma who is at risk for developing acute respiratory distress syndrome. The nurse assesses for which earliest sign of acute respiratory distress syndrome: bilateral wheezing, B. Inspiratory crackles, C. Intercostal retractions, D. Increased respiratory rate. The answer is option D, increased respiratory rate. 36. 36-year-old male patient complaining of fever and headache for 3 days now. When examining this patient, which of the following signs would indicate that this patient may has meningitis? A. Positive Kernig sign, B. Negative Brudzinski sign, C. Positive Homan sign, D. Negative Kernig sign. The answer is option A, positive Kernig sign. 37. A patient presented with high fever, headache, vomiting and neck stiffness for the past 3 days. Which of the following is the first diagnostic intervention for this patient? Urine and stool analysis, B. Lumbar puncture with CSF aspiration, C. Complete blood count, D. Chest and abdomen X-ray. The answer is option B, lumbar puncture with CSF aspiration. 38. MSA, methicillin-resistant Staphylococcus aureus, is transmitted by A. Contact, B. Airborne, C. Droplet, D. Standard. The answer is option A, contact. 39. What is the best indicator of effective treatment of CHF in patient taking Lasix? A. Calculating total intake daily, B. Weighting himself daily, C. Calculating urine output daily, D. Assessing fluid status daily. The answer is option B, weighting himself daily. 40. What supplemental medication is most frequently ordered in conjunction with furosemide, Lasix? A. Chloride, B. Digoxin, C. Potassium, D. Sodium. The answer is option C, potassium.
Thank you for watching.